Yeah, okay, so the recording has started, and please switch off your cameras if you don't want to be recorded, and please mute yourself so that there is no audio that comes through while it is recording or while the presenter is presenting. I think Vibhas may take questions in between, but I would like to hold up those questions till the end. And please put your questions in the chat or unmute yourself to ask any question directly to Bibas. Thank you very much. And I now hand over the mic to Bibas.
Thank you. Thank you, Dr. Murthy, for your kind invitation. A number of years back, me and my family passed through Adelaide on a short vacation, also went to Kangaroo Island. So it's great to reunite with the Adelaide community professionally at this time. Dr. Murthy mentioned about my work on causal inference and dynamic treatment regime, but I'm not going to talk about those things exactly today. Instead, I'll be focusing on probably a little more timely topic of mobile and digital health. Everyone is interested in, everyone is talking about it. And in particular, how we can use this reinforcement learning technologies into this space. And again, I want it to be, discussion type. And I have a number of slides, but I don't necessarily have to cover everything. I would rather have you ask questions and interact. I don't mind getting questions in between. Okay. So as you know, mobile phones are everywhere, which presents an opportunity to reach underserved populations and reduce disparities. With that, we have this field called mobile health, or mHealth in short. Basically, it involves use of mobile and other wearable devices, wearable technologies for managing one's health and wellness. And it can mean a variety of things. But in today's talk, I'll be focusing on the aspect of mHealth that involves sending personalized and timely messages or push notifications or nudges, so to speak, through your smartphone or digital device. And these are all behavioral nudges, behavioral interventions, also sometimes called just-in-time adaptive interventions, or JITIs in short. Okay, so with that, the idea is to go into the topic of micro-randomized trials, a new kind of trial design, and I'll give you a couple of examples. And then we'll talk about how this reinforcement learning, or more specifically, Thompson sampling type of algorithms, can be incorporated into such trials to make them adaptive, more participant-centric, user-centric, so to speak. And I'll talk about more about different outcome types, continuous and count type, and then wrap it up. That's the plan. But again, I'll remain adaptive to the questions. Okay. All right. So what is micro-randomized trial? It is basically a trial designed to inform the development of these JITIs, these new kind of interventions. Now, many of you may be familiar with factorial designs, which are basically gold standards when you have multi-component interventions, and often quite popular in the behavioral sciences. I mean, long back it was developed for agriculture and industrial experiments, but in the space of health and behavioral sciences, these are primarily used in these behavioral interventions where there are multiple components. Now, that's a static design. That's just one time point, multiple factors, you randomize, cross-randomize. However, micro-randomization involves a bit more than that. In a way, these are sequential full factorial design. If you have multiple factors, but not just that, you are also randomizing people again and again and again, because just-in-time adaptive interventions In order to build them, you have to test out the different components of these nudges again and again, many times. So these involve many decision stages, and you randomize between possible intervention options. Could be the same ones repeatedly, but could be a bit more depending on different situations. And each person may be randomized many times. It could be in the hundreds, and in fact, there are some examples that I'm not directly involved in, but it could be even thousands, depending on how frequently you are randomizing people to the nudges. It could be every couple of hours. It could be a bit boring or too much intruding, but depending on the context, this may be okay. So this is the basic idea of micro-randomization. If there are multiple factors, then it's a factorial, but it's also sequential over time, within person sequential. So every cross-section of the design is a full factorial design, the good old factorial design. Okay. But then there could be also less number of factors or maybe single factor. Then it's not even a factorial. It's like a regular RCT at each time point, so to speak. Okay, so this micro-randomization, here the intervention components are often intended to have proximal effects. What do I mean by that? That means, for example, if you are talking about an exercise promotion intervention, then the message that you are sending, the nudge that you are sending now, it's only expected to have an effect in the next few hours, or maybe at most today, but you don't expect it to linger on for more days or more in a longer period, right? So that's why we are interested in proximal outcomes and proximal effects of our interventions. And this micro-randomization helps to generate the right kind of data to assess the causal effects of these estimates, of these proximal outcome, of these interventions on the proximal outcome. However, we are not, today's talk, I'm not going to go into the details of causal inference here. Instead, I will be talking about some algorithms to adaptively allocate the interventions. Now, you might be wondering, is that proximal outcome the end of the story for these interventions? Of course not. Of course, we have distal or long-term outcomes. So for example, suppose you are promoting exercise among patients with diabetes and depression and so on, right? Some hard clinical outcomes. So those are the distal outcomes that we really care about. And based on the scientific theory, you would expect that the proximal outcomes will eventually impact the distal outcomes. But for the purpose of design, for the purpose of statistical considerations, we are not bothered about the distal outcome. We know that from the scientific theory that if we work on the proximal outcomes, they will eventually translate to the distal outcome. So that's one thing to keep in mind as we progress. Okay, so these GTIs and MRTs has been getting popular over the years, as you can see from the trends. And here is one of our article, a review article that appeared in the American Journal of Public Health last year. This is my PhD student. Student is the first author. So this is a very accessible article, not too technical. If you are interested in this area, you might want to take a look. Okay, so our first example, this is called Drink Less Micro-Randomized Trial. It's from the UK. This is an mHealth app targeting people who have hazardous levels of alcohol consumption. So here it's a 30-day intervention period. So there are 30 time points of intervention. And of course, all these contextual variables, age, gender, time, yesterday's engagement with the app, etc. This is an alcohol reduction app, right? And this in this trial design context, we use the word context. This is the good old covariates, so to speak. But this coming from that the computer science kind of literature, Thompson sampling, contextual bandit, reinforcement learning. In that literature, the word context is sometimes used, but it's basically covariates in our statistical terminology. Then the intervention is a binary intervention. It's not even a factorial structure. It's very simple. It's sending a certain kind of message versus not sending anything, no notification. So that's binary, but this is being repeated. And then the proximal outcome is the engagement with the app measured by the number of screen views in the hour following the notifications, which is 8 p.m. to 9 p.m. This, behavioral scientists figured that this is time when people are vulnerable to drink more, right? So this is the target time. And then the distal outcome is drinking less in the long term, right? Is like a behavior change, but we have to look through this engagement variable, which is the number of screen views, that is the proximal outcome. So that's a very simple example. I'll go to a more complex example, and then later on come back to drink less again. So this is a trial from California in the US. So this is called Diamante, acronym for Diabetes and Mental Health Adaptive Notification Tracking and Evaluation. And I got connected to the PIs through a common friend who is a computer scientist. And the PIs, the behavioral scientists, came to the computer scientist to do some machine learning type algorithms embedded in their app-based trial. But my friend, computer scientist friend who was not experienced with trial designs as such, got me into the loop, and that's how we all work together in this Diamante trial. So this also involves an app. This is for, as the name suggests, this is for diabetes and mental health comorbid kind of people who are suffering from both diabetes and depression. And the idea is to promote exercise. I give you some website link for this lab, which is leading it at the UC Berkeley. So the goal here was very ambitious. It was to develop, implement, and evaluate an adaptively learning mHealth intervention targeting physical activity, specifically walking, to manage comorbid diabetes and depression patients in the San Francisco area. So it has to be not just an app-based intervention. It's adaptively learning. It wants to learn as it goes, as it progresses. So that is even more challenging than just micro-randomization. Here, the goal was to send contextually tailored text messages that are multifactorial interventions. And I'll show you exactly how those are multifactorial in a minute. And then the goal was also to continuously learn and while in the trial, to send better messages to encourage people to walk more and deploy that knowledge as it becomes available. So earlier I talked about pure micro-randomization. You just evenly randomize as you go. But this is adaptive micro-randomization. I'm assuming that at least some of you, if not all, are familiar with basics of adaptive trials, adaptive drug trials, for example. So you start with even randomization, but as some evidence accrues in favor of one drug versus the other, then the one that is performing better gets allocated more, right? That's the idea of adaptive randomization in a regular two-arm RCT kind of setting. But we will expand on that idea here to incorporate that adaptive element into the micro-randomization. So this is what would be done using the machinery of reinforcement learning, and I will come to that. But this is our protocol paper from this study, in case you want to take a look. Okay. So here is the big picture of the Diamante trial. It's not just one micro-randomization thing. It's micro-randomization embedded within a three-arm, three-group RCT. So there is a control group, which I denote by C, which we can ignore for now. And then there is a static messaging group and an adaptive messaging group. So static messaging group, they get daily intervention messages, which are micro-randomized, purely micro-randomized. And then there is a second group, group B, which is adaptive messaging group. Again, they get daily intervention messages, but it's not just pure micro-randomization. They are adaptively micro-randomized or learned by the reinforcement learning algorithm. So there are three arms. There's at the macro level, it's a three group RCT. And within the 2 out of the 3, except the control group, 2 out of the 2 active groups, they get some kind of micro-randomization. One group gets a pure micro-randomization. The other group gets adaptive micro-randomization using reinforcement learning. And what are the different elements or factors in the intervention? I'll come to that in a minute. So this is what everyone gets. So I was talking about earlier from the researcher point of view, but now I'm showing you some screenshot of what the users, the participants are getting, right? So on their phone, they are getting 2 different intervention messages, probably 1 minute apart. And one is a motivational message and the other is a feedback message. And they are getting it every day. And they look like this. Okay. All right. So I mentioned it's a multifactorial intervention. So factor 1, first factor is a motivational message. And people from both the group A and group B, who are either uniformly or adaptively micro-randomized, get some of these messages. And here for the factor 1, I have 4 categories, M0 through M3. And they talk about different aspects of people's motivation. It involves no message also, but then the active ones are about self-belief or self-efficacy, and then benefit of walking and the opportunity of walking, whether there is a park nearby, whether the weather is good, you can go out for a walk and so on. And of course, people, some of you have some psychology kind of background, you know the benefits of, you know the impact of self-belief and self-efficacy in these kind of interventions. So those messages specifically target those aspects of human behavior. And the message bank were tested out before on the Amazon Mechanical Turk crowdsourcing platform prior to the main clinical study. The next factor is the so-called feedback message, which tells people how much they have been walking, or what is their step count, whether they can do better, and so on. Different ways of message framing are shown here as the different categories. So there are 5 categories, F0 through F4. And finally, the time of the day when the message was delivered, that was also varied across 4 categories, 4 time windows. Then there are many contextual and outcome variables here, as you can see, some of the baseline demographics, socioeconomic status, health status, physical activity measurement, and also the time varying ones like the day of study, day of the week, number of steps walked yesterday, days since each message type was sent, etc. And some of these are actively captured in order to take care of a phenomena called habituation. As we all know, we don't usually stay committed to these behavioral interventions for very long. Very few of us do. And then also, this is a common problem with digital, any app, basically, right? So you initially get excited, but after a while, the effect diminishes. So this is called habituation in behavioral sciences. So how long you have been in the study, that impacts, or how long ago you got a certain kind of message that impacts the effect. So those things are taken into consideration as potential time-varying covariates. And then the primary outcome in the study is the number of steps that you are walking in the next 24 hours following the intervention message. And these are passively collected via the phone speedometer or the apps. Okay, so here is a sneak peek into the raw data of Diamante across all the arms combined. So it's a highly skewed data, of course, there's a large count. And we tried different transformations. Square root transformation makes it a little bit more symmetric. So we'll work with that for now. Okay, so another sneak peek into the key result from this trial. And for this result, I would want you to forget about micro-randomization and adaptive learning for a moment. Just think of this as a 3-group RCT, right? And here we are doing a linear mixed effects model analysis. And we are seeing the trends here. How is the effect of these different intervention groups? They change over time. And what are we seeing? We are seeing that over time, the control group and the random group, meaning the uniformly micro-randomized group, those things, the effect, the number of steps is diminishing over time, is reducing over time. But adaptive control group, it's increasing, which is really great because that's where all the machinery were put in, the reinforcement learning kind of algorithms were put in. So they were learning about the people's behavior and sending hopefully better messages than randomly allocating messages, right? So this is the benefit of adaptive randomization, where people are getting the messages that might work for them, that they might like and act on. So this is the overall picture, that adaptive group is, in fact, I'm not showing the p-values and all here, but it is actually significantly better. So that's great news. But the only thing is, I have not told you what we did, what algorithm we did. So now I will unpack that. But before that, I just wanted to show you the overall result, the end picture, right? So this has some merit. It is doing better than uniformly giving people the intervention. Okay, so I think this is the basic part, and I can take question, maybe one question if there is any. Otherwise, I'll move to the next section.
Could I just ask what sort of algorithm is the Thompson sampling? Is that like a policy based or value based?
Yeah, I'm coming to that.
Yeah, okay.
That's exactly what I'm coming to. Okay. All right, so let's talk about reinforcement learning and Thompson sampling then. All right, so the data structure, it's a bit more than the standard longitudinal data that we are all familiar with. Here, there are T stages or decision points on a single individual. We call them X1, A1, Y1, and so on, where XT is the context at time T, pre-treatment variables. AT is the action or treatment or intervention. YT is the proximal outcome, also called response or reward. And in case of multifactorial interventions, AT can be a vector, as in Diamante, because there was this motivational message, feedback message, time, etc. And then XT can be high dimensional. It can take a lot of variables in. So reinforcement learning, a branch of AI, this is an old area. This deals with learning to take better actions, in our case, interventions, in an environment by interacting with it. And this has classical applications in robotics, automated flights, games, etc. In particular, in our context, we'll be dealing with these contextual bandit algorithms. These are short horizon RL algorithms. RL algorithms in general, they can be many, many stages long, but here contextual bandits are relatively shorter horizon, and they are very useful for customizing GTIs or this adaptive randomization, adaptive learning within an micro-randomized trial. But this is only in our health or behavioral space, but these algorithms really got popularity in the online advertisement industry, like the Google and Facebook and so on, right? So they, at the back end, they use some versions of these reinforcement learning, these contextual bandit algorithms. A common feature of all these algorithms is this so-called exploration-exploitation dilemma, which basically means at any given point, the algorithm is keeping track of the rewards associated with different actions or interventions from the past experiences. So at any given point, before choosing an action, the intervention, the algorithm has to decide, has to select interventions with the highest expected rewards based on the current estimates, or to explore further, because these are the outcomes, the rewards are stochastic, so it doesn't really know for sure that this is the best for sure, right? It doesn't know. It has to still, it may want to explore a bit more to see there might be hidden treasures somewhere else, right? So that dilemma these algorithms face, and there are various ways to deal with it, and change that allocation, randomization, and in fact, this adaptive randomization versus deterministically picking something is an implication of this dilemma. Because of this dilemma, this algorithm still randomizes to some extent, maybe favors the randomization, tilts the randomization probabilities towards some actions, but still it randomizes in order to allow that exploration. Otherwise, it would become fixated and choose actions deterministically, right? So that's something happening in the background. Okay, so one popular algorithm is Thompson sampling. This is actually an old idea from statistics literature. It's a posterior sampling idea, and it's based in Bayesian statistics. So what it does is it specifies a reward or outcome model. It specifies some prior distributions for the model parameters, and then at any given step, it computes a posterior distribution of the parameters based on observed data, and then selects the action that maximizes the expected posterior reward at the given context. And based on that, it generates corresponding reward or outcome data, and then repeats the steps. So this is the overall idea. And one common version is the so-called linear Thompson sampling that got very popular in the computer science world. And these are suitable for continuous symmetric outcome distributions. Again, specifically for the statisticians in the audience, here we assume a normal reward model. And this is basically what we used in case of the Diamante study. It's a outcome model is normal, and then a normal prior for the parameters, and then posterior distribution of beta is also normal because of conjugacy. And then basically we follow the steps that I just mentioned in the previous slide, choose the optimal action according to this model, and observe Y and repeat the steps. In case of Diamante, because the study was a daily intervention, so the model need to update overnight, every 24 hours, and every day after, like night time after it updates, then the next day it allocates treatments based on the new betas. The posterior draws from the beta distribution. So that's how the basic Thompson sampling was operationalized. Okay. So now I'll move to the next section, which is also Thompson sampling, but this is for a different outcome type. So far, I was talking about continuous and relatively symmetric kind of outcome, normal type of distribution. But here we'll be talking about count data. In case you forgot, this is the slide I showed you about the drinkless micro-randomized trial from the UK. So here it's much simpler. The intervention setup is much simpler, but the outcome distribution is more difficult. So here we don't have a factorial structure. It's just one intervention, sending versus not, binary. But then we have the mixed type of context, and we have this proximal outcome variable engagement with the app, which is measured by the number of screen views. So this is how the data look like. Highly skewed, high zero inflation, those kind of data. And we noticed a lack of algorithm for potentially zero inflated and over dispersed count outcomes in the literature. So we wanted to address that gap methodologically. So far what I spoke about is it was an application of existing methodologies, but this is a bit more of methodology development. So as many of you may be familiar, there are various count models in the statistics literature, Poisson, negative binomial, zero inflated Poisson, and zero inflated negative binomial. I will not go through the equations, but this is just for displaying the different models. One thing to note here is that the negative binomial with unknown dispersion parameter R, and then the ZIP and ZINB, these models do not belong to the classical generalized linear model family of distribution. So that needs some special consideration. But regular Poisson distribution and negative binomial with known dispersion parameter, these belong to the GLM family, which has been handled before. So what are the special challenges of count data, and how could we get around them? So the challenge is that the posteriors derived from the likelihood functions of count data models and the normal prior are intractable due to the lack of conjugacy property. And if you want to do approximate sampling by Markov chain Monte Carlo, then that may be also very time consuming. Is there a quick fix to address this? So the remedy that we work with is, instead of sampling from the intractable posterior, we sample beta t tilde from a normal distribution with mean equal to the maximum likelihood estimator at time t of beta, and then a variance involving Fisher information and a tuning parameter. So these are like classical likelihood-based quantities that are used to draw the posterior sampling. And this is called Laplace approximation. And what is the justification for that? A justification emerged only a few years back in the AI stats literature. So they showed theoretically that any posterior distribution that permits Thompson sampling to explore far enough from the MLE, but not too much. And they quantified what that means. So under those conditions, under that concentration and anti-concentration properties, it can be guaranteed that the Thompson sampling will perform well. And what does that mean? What it means to perform well, I'll come to that. So we have this paper currently under revision for the Annals of Applied Statistics, and we also have an R package that is already available called CountTS. Again, the first author is the PhD student. Okay, so these are just the algorithms. I'm not going to go through the details, but I just want to mention that there are two versions. We have two versions, one for data without zero inflation and another for with zero inflation. And basically it involves the algorithms. These are all gory details, but the main thing is how do we draw the samples? How do we do the posterior sampling? And as I said earlier, this is done from a normal distribution, even though we are dealing with count data, right? This is the Laplace approximation I mentioned. So this is the posterior sampling of beta. And then with zero inflation, there is this additional parameter of gamma, which is the model of the zero inflation part. So we have to draw both gammas and betas, and we do it also from normal distribution. So that's the basic idea of these new algorithms that we are proposing, TS count. So now we talk about the performance metrics of these learning algorithms. How good is good, or how do we know whether something is doing well? So there is this concept called regret in the computer science literature. It's as we understand it in plain English. Oh, I wish I could do better, like the Oracle, maybe, right? That's the concept. And this is operationalized by the expected difference in outcomes between the Oracle, who knows the truth, who knows the true parameter values, and any candidate algorithm, right? That's what is quantified here with the equations. And there are two versions. One is the frequentist regret, which is given a parameter, true parameter value, and a Bayesian regret, which averages over possible values of that true parameter, because it views those as random also. So so these are the two versions of the regret. Bayesian regret is like the average case of regret. On average, how much you would regret. Whereas the frequentist regret often is stricter. It deals with like the worst case scenario, because it's for any given value of the true parameters, underlying parameters. So we have done some theoretical work in this space. The culture in the Thompson sampling or contextual bandit algorithms is to bound the regrets for any algorithm, right? That's how the performance is viewed. So regret bounds for Thompson sampling with GLM family of distributions already exists. However, negative binomial with unknown dispersion as well as the zero inflated models do not belong to the GLM family. So that's where our contribution lies. We prove under certain conditions, certain bounds that are comparable, both for Bayesian regret and for frequentist regret. We create some bounds that are comparable to the bounds, all existing bounds for generalized linear models. So even though these distributions are not strictly a family within the GLM family, we show that in terms of regret, it doesn't matter. They are comparable. And frequentist regret bound is, this is bigger regret, of course, because this deals with worst case scenario, not on average. So this gives different kinds of protection. Okay, finally, some simulation results, all for frequentist regrets I'll be showing. And here the true data generative model is an over-dispersed Poisson. And let's see how different models perform here. So the yellow line of the band that you are seeing, this is about the linear Thompson sampling, even with a log transformation with the data. In order to make it more comparable, more even playing ground, we log transformed the data to make it less skewed, and then we applied the linear Thompson sampling and see how the regrets look. By the way, I need to tell you that here, these are cumulative regrets. So what we want, the algorithm, is to bend the regret curve, right? If it goes linearly, that means it's not learning. It can never go below. It can never go down because this is cumulative. It's not every time point a separate thing. It adds up, right? So at most it can flatten. So our goal is to flatten the regret curve. If it goes very sharply high, then it's not learning. So that's what's happening with linear Thompson sampling. But all the count-based models, when we are incorporating that into Thompson sampling, the regret curve is bending, right? That's an improvement. And we varied the degree of over dispersion in the different panels. Here we experimented with zero inflated over dispersed Poisson model. So it's not just over dispersed, but also zero inflated. And we see some separation in the models. So linear Thompson sampling, of course, performs poorly, but the Poisson and negative binomial models without zero inflation adjustment, they are also not doing very well. However, the zero inflated models, when we incorporate them into the Thompson sampling, they are doing well. They are bending the curve. And in fact, the Poisson versions compared to the negative binomial versions, they are doing better. That is another observation here. So for the zero inflated data, the green one, which is the ZIP model, zero inflated Poisson, that is doing the best. And if I go back to the previous slide, here, the red one, which is the Poisson, that is doing the best, which is the lowest regret. So Poisson, zero inflated or regular, is doing better than the negative binomial. Okay, so now we come back to the Drinkless study. Remember, the Drinkless study was not done in an adaptive way. This was a regular micro-randomized trial. So here we use that data. We do a simulation study based on the real data of MRT to see if we were to redesign the trial, considering the adaptive versions, how would that look? How would that take better care of the participants in the trial? So here you see the top line is the uniform randomization, which is the regular one, the one that was used in the trial. But everything else does better in terms of regret. And initially, this is quite interesting. Initially, the linear Thompson sampling with log transformation, that works the best when the accumulated data is small, when the time t is very small. But after a bit, the count data models begin to dominate. Why is it so? We think is because initially there is too little data for more complex models like any of the count models to learn effectively. So that's why the linear model was still doing better. But when there is sizable data, then gradually the count models are showing its benefit. Okay, so that's pretty much what we have in the findings. I'll remind you what I wanted to say. So take-home messages. First is that MRTs are cutting-edge trial designs in mHealth that can be made adaptive by these kind of algorithms, thereby improving the trial participants' outcomes. So it's really participant-centric, user-centric, not just future users, but the users who are involved in the trial. And methodologies and softwares are available for zero-inflated count outcomes for adaptive MRTs, in addition to continuous and binary outcomes. And complex models like negative binomial or its zero-inflated versions may not outperform simpler models like the Poisson and its zero-inflated versions in the online learning settings like mHealth, likely due to limited data early on. So these are online learning settings, as opposed to whatever we do or whatever we have been doing traditionally in classical statistics. We already have a study complete, and then we are trying to learn from the data. So that's an offline learning. Whereas this is online learning. We have to learn as we go. So here, we have to sometimes revise our understanding about different models. Like more complex models may not work very well initially in an online setting. So if the trial size is relatively, trial duration is relatively short, then we may want to opt for simpler models, as we have seen here, as we have learned here. Some of the future works, and this is something people ask me, and I say that, yes, these are something I have not talked about formal statistical inference in that part. I talked about formal inference early on when I showed that overall this reinforcement learning arm is doing better, but that's classical stuff. But in case of this online learning of the algorithms, there is very little work so far on the statistical inference, and there is opportunity to do more. And then another point, the second point is about information borrowing between different users to increase efficiency of our estimation. Because here, the results that I showed for this one is regrets averaged over 50 users. We can view every user as like a one trajectory learned by an algorithm. But can we learn across people, borrowing information from each other and do better for people? That is still needs more work. And then I talked about the posterior sampling in a certain way, the Laplace approximation, normal approximation, but there could be alternatives for posterior sampling. Okay, I just wanted to show that there is, in fact, to my knowledge, there is one study that is happening in Sydney. I've been working with this group at University of Sydney, and this is just the protocol. We don't have any data yet, so unfortunately, I could not show you any results, which I thought might have been more interesting to you all. But maybe next year, sometime it might be available. Okay, that's all from me. Thank you. You can take questions now.
Thank you very much, Bibas. I think we have two questions, one from Shahid in regards to your square root transformation.
Yeah.
What's wrong if I use mixed effect Poisson or negative binomial rather than taking square root for making Gaussian distribution?
Let's go back. Yeah, so what's the question again? So you want to do...
They wanted to do a Poisson model instead of taking a square root transformation and then using a Norman model.
Yeah, I think you could. There is nothing right or wrong here. We just did it this way for maybe more, for simplicity, I would say, to a wider audience. Yeah, nothing wrong with that. You could do that.
There's another question from Richard. I hope Bibas's answers your question, Shahid. If it does, then we move on to Richard's question, which is, can the models be applied to settings in which the subjects differ rather than being the same subjects tested many times?
Yes, so here we are using it for different subjects, right? It's not like one subject using it. So when we are doing the trial, we are doing it for the different subjects, but the algorithm is proceeding as if there are, say there are 50 participants, then as if there are 50 different trajectories where the algorithm is running. So 50 different contextual bandit problems, 50 different learning problems. So that's what I said, that towards the end, as the future work, it could be whether we can do the information borrowing.
Yeah,
The second point.
I think you answered the question just as I was typing it. So yeah, I understand that you've got different subjects within your trials,
Right.
but so you've got a lot of longitudinal data available to you.
Right.
So I was just wondering whether it's still feasible in the setting where you may have patients which are only seen once or twice, but you've got many patients with the same set of comorbidities, and you were aiming to develop the best prescribing strategy for these patients, but you didn't have lots and lots of repeated information.
Yeah, so you are talking about a slightly different problem. So where that is basically done in the offline learning, right? So you learn from people, and then at the end, here this is online, which is more within person. But then there is an algorithm here. I mentioned, we have not done it specifically in our application, but information borrowing between different users. So there might be similar patients. You may want to tap on their data and give the best possible treatment to the current patient. You can do that. Yeah, is done for it has been done. This Tompkins et al. Paper appearing in Machine Learning, that journal. I think they do it for continuous data. We have not extended to the count data yet, but it exists.
Yeah, I think you've answered most of the question I had. I mean, I'm thinking about the number of possible policies in your setting. Is it an infinite sample space, or is it restricted because you've only got a certain number of messages that you can send out?
Right. Exactly. So it's restricted, and it's not infinite in that sense.
So it wouldn't necessarily work in more complex settings.
Probably. Yeah. What setting you have in mind, may I know?
Well, where
maybe a dose, like a continuous dose of something.
Yeah, that sort of thing. Yeah. So you've kind of I mean, you can always categorize the continuous space, I suppose.
Yeah, that's what I would do. I mean, I've not seen any work in this area which handles continuous intervention, continuous treatment, right? It's all discretized.
Right. And did the effectiveness of your intervention, I mean the reinforcement learning intervention, did the effectiveness of that vary depending on how far into the trial you were? So at the start of the trial, I'm presuming it wasn't necessarily the best.
Right.
Is that correct?
Right. So that is what we show here. That's it. Yeah. Right. So initially it was not doing very well. Gradually it learned. Right. That's the trend.
Okay. Yeah. All right. Thanks very much.
Okay. Thank you.
There's one last question in the interest of time. Can you please comment on the sample size, follow-up time, and number of arms in Thompson sampling and their effects on sampling efficiency, convergence, initial priors, and certainty of posterior distribution?
A lot of things.
Yeah. Maybe if you can cover the sample size. Or
sample size. So, right. Yeah. So sample size is difficult here. So there are exact formulas for micro-randomized trial without any adaptive algorithm. There are published work at least 2-3 papers there exist for pure microrandomization. Closed form solutions you might get. But then when you have adaptive design, even for adaptive RCT, it's very tricky to get an exact formula, right? So the same holds here. You may not have a closed form formula here, but you have to do simulations to see which sample size is reasonable. But having said that, let me tell you give you some idea about the sample size, because it accumulates information over time for the same interventions over and over again. So it gains a lot of efficiency in terms of sample size. So there exist many microrandomized trials whose sample sizes are maybe less than 100 even. Our Diamante trial is a bit more.
We have booked this room, but we can take the room next.
Just give me 2 minutes.
2 minutes.
So it could be around 100 sample size, reasonably good, 100 to 150. Those kind of sample sizes are pretty good for microrandomization, even with Thompson sampling. Some ballparks.
Yeah, I think I would like to thank you for stimulating presentation and also very informative discussion around the trial. I'd like to thank all the participants who have taken interest in posing some questions, and I would like to request all the participants to join me in thanking Bibas for this interesting presentation. Sorry, I got to cut this down because the room is booked for another meeting and we have to leave the room. But thank you very much, Bibas, and maybe we stay in touch to exchange some discussions from any of the participants.
Yeah.
Thank you very much.
Thank
Bye.
You. Bye.